good evening to all of you and welcome to the Mentora platform of NEET PG Counselling 2025. So first of all, I wish you a very congratulations to all the students who have secured a very good rank in this NEET PG 2025 session. Okay, so myself, Dr. Shazia Khan, I am an MD pulmonologist. I have done my post graduation from BJ Medical College, Ahmedabad, and currently I am working as assistant professors in one of the medical colleges in Rajasthan, Udaipur. Our team Mentora is a platform of all postgraduate doctors. Dr. Aftab Ahmed Khan, he is MS Ophthalmology, DNB Ophthalmology from Deen Dayal Upadhyay Hospital, New Delhi, and currently he is also working as a consultant in ophthalmology. Dr. Ashwini Gupta, she is DNB Pediatrics from Santokba Dullabji. Dr. Anshu Arora, she has done her MD Medicine from Jamnagar, Gujarat. And Dr. Vamsi Krishna has done his DNB Medicine from Northern Railway Hospital, New Delhi. So Team Mentora is a hub of doctors who have already done post graduation from different parts of the country, and we know your needs, we know your requirements, and we know what is going in your minds because we have gone through the same platform through which you are running right now, because this is a game changer platform for your life. Okay, whatever branch you will be choosing according to your rank. Now one thing, some of the students will be having ranks in 100, some of the students will be having ranks in 10,000, 20,000, 30,000, 40,000, 50,000. Whatever rank you have, dear students, first accept your rank. Okay, so you have achieved the best of the result through your studies, and whatever you have got is the best for you. God has written something best for you, and whatever branch you are going to take at this point of time for your ranks, that will be going to live throughout your lives. Okay, your branch will be your second. Mute yourself, all of you. There's a lot of disturbance coming. Okay, so your branch is going to decide your future. So you have to be very careful at what is your interest. You want to go towards a medicine based branch or you want to go towards a surgical based branch. This is the first big difference you have to make at your session. And to hear about some pros and cons for medicine, we have some faculties today with us who will be joining very soon with us. So before going to the medicine branch, we will just take an overlook of this NEET PG counseling. This is just an orientation Zoom session as what is going to held ahead, and after that we will be keeping one more Zoom session that will discuss the rules and regulations of the NEET PG counseling. But once the rule booklet comes out, after that, once your seat matrix comes out, immediately after that we are going to take that session. Okay, so this is our orientation session. So Team Target DNB MD is a platform of Mentora, welcomes you to the mega Zoom session with the new changes and updates regarding the rules and regulations. So this is a short Mentora note for all our dear students. Congratulations to all of you on your remarkable achievement in NEET PG 25. NEET PG counseling is a tricky process where you must choose your branch very carefully. Okay. So congratulations to all of you on your remarkable achievement in NEET PG 2025. One more thing, the chat box is open for all of you. Whatever doubts you have, whatever questions you have in your minds, our team is here to reply you in the chat box. So please ask your doubts in your chat box, and meanwhile we go with the discussion ahead. So NEET PG counseling is a tricky process where you must choose your branch very carefully. Remember, the branch you select will stay with your life throughout. Now you are about to going to begin your journey in the medical field. This postgraduate journey will shape your future, your knowledge, your skills, and even your lifestyle. Therefore, it is very important to take proper guidance from experienced seniors. Fortunately, Team Mentora consists of highly experienced doctors and IT professionals who have successfully completed their post-graduation journey from reputed institutes across India. We are all practicing clinicians in our respective fields. At Mentora, we don't just analyze data or filter information, we use our real life experience and expertise to guide you in the right direction at a very affordable cost. As a result, we have created numerous success stories over the past years. We strongly believe in building trust with every PG aspirant. Join Mentora today and shape your future in the right direction. So, a short note about choosing your counselor. So, ask yourself, how can a non-medico guide you in such a critical decision? So, choose your counselor. It is as important as choosing your branch. That is why you should choose wisely. So, Team Mentora is the biggest online coaching and counseling platform created by the doctors for the doctors to support you at every step right from the beginning of your residency. We are not just filtering out data, we are skilled medical professionals who have successfully completed our own PG journey and we are now practicing clinicians. We carefully analyze your situation. We prepare a preference wise list. So, this is the one and only platform which gives you a complete preference wise list of your preferred branches in a proper systematic order. Okay, the way you have to fill the institutes at your rank, what are the possibilities at your rank for your preference branches. If you are confused with the branches, we first guide you what branch is possible at your rank and how to go further with the preference wise list, how to fill the list, what is the bond status, everything we are going to tell you in our journey. So we guide you in choice filling so that you don't go blindly but instead make an informed and confident decision. So we are confident enough in making the list because we know what is happening in each and every institute across the country, because Mentora has already released a lot of students who are working in different parts of the country, who are in constant touch with us, and they tell us the pros and cons of their institutes and we are constantly in link with them. So we know what is good and what is bad and we make the list accordingly. So no other counseling platform is there at present who is giving this proper preference wise list. 99% our list is accurate. 1% the choice differences can be with anyone. I can say that this is not good, you feel that this is better. So that 1% difference will come in each and at every point, but 99% our list is accurate enough for you to fill, and that makes the mindset of the students that yes, I should go with this branch and these are the possible institutes, I should go with that. So don't go blindly, choose wisely with Team Mentora. So these are the courses which are offered by Mentora. NEET PG Counselling, All India Quota, State Quota, Deemed Quota, Open Seats. There is one-to-one genuine and authentic guidance because every enrolled student will be given a guide who will be in constant touch with the students. We will be talking to you, we'll be chatting with you, we'll be clearing your doubts till you get a proper seat. There will be state-wise college preference list for your branches. There will be call support and proper Zoom sessions for the enrolled students. Rules and regulations of the counseling will be shared. Regular updates will come on a dedicated WhatsApp group. Bond details, stipend details, DNB rules and regulations. What are the seat leaving rules? What are the resignation rules? What are the exam dates? Everything. Another important thing, as you enter in your residency, Mentora also provides you a coaching platform for DNB, Diploma, MD, MS, exit exam students. At present, we are running with our coaching in general medicine, pediatrics, respiratory medicine, general surgery. Very soon, we are going to come up with the other subjects also. We'll be telling you about the academic work, protocol, thesis, paper, poster presentation in national and international conferences and journal clubs. So, what is the important points of NEET PG counseling? What the MCC includes in your counseling. Now, students have a lot of confusion at this point. So, first and foremost thing, IQ government medical seats. 50% of the seats are in government quota. The 50% of the government seats will go in state quota. Okay, this is the first thing that should be very clear. Whatever medical college is releasing a seat of that particular branch, 50% of the seats will come in the government quota and 50% will come in the state quota. Then deemed universities, 100% of the seats of deemed universities will come in all India quota. ESICs will come in All India quota. Central universities, your AMU, BHU, they will come in All India quota. DNB, NBE diploma seats and AFMS. These are the seats which are included in All India quota. Now students have a lot of confusion. Low budget private medical seats. Low budget private medical seats will only and only come in state quota. They will not come in All India quota. Deemed universities are not low budget private colleges. Deemed universities are separate universities which have in general a basic fees of 30 to 40 lakhs. Average for each and every subject varies with the branch you are taking, but these are not low budget private colleges, and these deemed universities are 100% present in All India quota only. Your low budget private seats will come in state quota. If you have any doubt, the chat box is open. You can ask your doubts there also. DNB seats, 100% DNB seats come in All India quota. Students have doubt, ma'am, can I take DNB through state? There is no DNB in state. There is no NBEMS diploma seats in state. So these are the postgraduate courses that you will be offered. First is your MDMS, running since years. This is a 3-year course, highest demand, oldest and most reputed, strong academic and clinical exposure, widely accepted for government jobs and teaching. Second is the DNB 3-year course, which is equivalent to MDMS after SRship. Now again, DNB and MDMS are total equivalent. Still today students are having confusion and they are asking us doubt, ma'am, is DNB equivalent to MDMS? Yes, after doing your SRship, your DNB is equivalent to MDMS. The job opportunities are absolutely equal for both DNB and MD student. The entry to DM super specialization is absolutely equal for both DNB and MD. Training of DNBs are usually done in private and corporate hospitals. Very few medical colleges are there which are offering DNB. Very few district hospitals are there which are giving DNB. Rest 80% of the hospitals are private and corporate hospitals, and the passing rate in DNB is low and the exams are tougher as compared to an MD/MS. But with the passing years, the passing rate is still improving nowadays. Previously it was used to be very bad, like 20 to 30%, but nowadays they are trying to improve the passing rate and it is not that bad as compared to previous times. Then the new course that has been introduced recently in the past 2 years is NBEMS diploma course. Now students again have a confusion, what is the difference between DGO and what is the difference between NB diploma DNB? What is the difference between DCH and what is the difference between NBEMS diploma? So your NMC diploma, MCI diploma is your previous diploma courses which are held in the medical colleges. Okay, if suppose BJ Medical College is holding a MD seat of MS seat of Obs Gynec, and diploma seat of Obs Gynec will come in that college, that will be called as DGO. These are the previous seats. Now very few diploma seats are left in NMC, that is DGO and DCH. Very few seats are left now because almost all the seats have been converted into NBEMS diploma. So NBEMS diploma will be similar to the diploma of DNB. So whatever the exam pattern the DNB students have to follow, the same pattern NBEMS diploma will have to follow. NBEMS diploma is also occurring in medical hospitals, private hospitals, district hospitals, but they are not usually in the old and recognized medical colleges. Okay, the exams of diploma and DNB will be conducted same. Okay, so the NMC diploma is also of 2 years, NBEMS diploma is also of 2 years. NMC diploma is old, well recognized, which is recognized by NMC and conducted in medical colleges. Mark, very few seats are left now, and the seats which are left, they are usually in category seats. NBEMS diploma, these are the new courses which have been recently started in 2020. These are recognized by NMC and the training is in NBE accredited institutes. So these institutes are again private institutes, corporate institutes, district hospitals, but they are not the basic renowned medical colleges. Okay, acceptance is gradually increasing because you don't have any option at a borderline rank. At a rank above 20,000, you don't have much of the seats in diploma left now, so you have to switch to NBEMS diploma to complete your degree. And after doing your both NMC diploma or NBEMS diploma, you have to do a secondary DNB in both the courses. That is mandatory for both the courses. Okay, so in short, MDMS is equivalent to gold standard, DNB is equivalent to NBMS but harder to pass, MCI diploma is old and recognized, and NBMS are new recognizing institutes. Okay, so to summarize the difference between NBMS diploma and NMC diploma, the conducting bodies are different. One is your NBMS, one is your medical college. Okay, training place for NBMS diploma will be in your private government institutes and hospitals, and NMC diploma will be in your medical colleges. Exams, these are conducted by just like DNB, and your NMC diploma are your university exams. Okay, recognition is both NMC recognized. Yes, many students are asking, is NB and MS diploma recognized by NMC? Yes, all 100% of the institutes are NMC recognized. Passing rate, again, because DNB has a low passing rate, so its diploma will also have a low passing rate. Obs-Gynae has a good passing rate of around 90%. For rest of the subjects, it is around 40 to 70%. ENT and orthopedics and pediatrics have a lower passing rate. Okay, both have to apply for secondary DNB in order to become equivalent to MS or MD student. Okay, so whether you are doing diploma in NMC medical college or you are doing diploma in NBMS, you have to pass an exam, again NEET exam for secondary DNB, and the secondary DNB will be of 2 years, and after that you will become equivalent to MDMS after completing your SRship. Okay, if still you have any doubts, you can ask in the chat box. We'll move ahead. So what are the tips for NEET PG branch selection? First and foremost thing is acceptance. So whatever you rank, your rank is there. You first have to accept your rank. Okay, you be proud of yourself, because qualifying NEET PG itself is a big milestone. So whatever rank is, accept it gracefully. You will surely get something good for yourself. Okay, now if you are thinking of drop, be very confident that you can study for one more year with the same enthusiasm and same dedication. And if you're confident enough that you can secure a good rank in the next year. But if your circumstances are not that beneficial for you, if they are not that fruitful for you that you can study for complete 1 year with the same acknowledgement, with the same dedication, please take any branch, whatever is available at your rank, take the best out of it and complete your residency. After that, you will be having ample of options in life ahead. But don't take a drop in mess. Don't take a drop when you are in a dicey situation. Okay, so accept your rank. Qualifying NEET PG itself is a big milestone. Be proud of it. Whatever your rank is, accept it gracefully. You will surely get something good for yourself. Now know your core. Am I a medicine person at heart or a surgical person? Don't mix these two extremes. Okay, take a paper, make 2 columns. One, write all the medical branches, write all the surgical branches. Okay, scratch and think deeply whether you want to sit in the OPD, see the patients, take ICU rounds, or you want to go in the OT, stand for hours, do an OT that makes you happy. Okay, now it is all an individual's mindset. Okay, some people will see, no, a scalpel in my hand and an OT table will make me proud of myself. Some people will say, no, sitting on an OPD table, seeing the patients will make me proud myself. Some people say, no, working in ICU will make me proud myself. Some people will say, no, as a pathologist, I am comfortable. Some people will say, as a pharmacologist, I am comfortable. Okay, so clinical versus non-clinical, and then medical versus surgical. Don't mix these two extremes, because one person can like only one thing. Either you will like medicine side or you will like only surgical side. So branches like medicine, general medicine, pediatrics, respiratory medicine, emergency medicine, anesthesia, pathology, all these are medicine based branches. Okay, surgery, oncology, obs gynec, ENT, ophthalmology, these are all surgical branches. Okay, so you have to be very sure whether you want to work in the OT, you like working in the OT. You must have undergone your internship, you must have seen rotation duties during your internship, so you must be having a basic idea what an obs gynec does, what an orthopedician does, what a medicine people does. Okay, so be very sure whether you want to go towards the medicine side or towards the surgical side. Don't mix these two extremes, then the things will become more clear to you. So choosing MD versus DNB for a medicine based branch, many students are having this doubt. For medicine based branches like general medicine, pulmonary medicine, anesthesia, emergency medicine, if available, prefer EMD, very good. If you are not getting MD, or if you are getting MD at a periphery state with a very high bond status, you don't want to go towards the periphery state, your parents are saying that take something near to your hometown, go and choose DNB. Why? Because one thing, you don't need surgical exposure, you only need patient exposure, that you will be getting in DNB also. Second, there will be no bond in DNB. MD, you have to suffice the bond also. And third thing, it will not make a difference in your career whether you are doing MD or DNB for a medicine based branch, because learning will occur in both the things, and frequently during your SRship you will be learning later on also. You don't need to develop extraordinary surgical skills. Okay, but things will be opposite for surgical based branches. If you are choosing a surgical based branch, always and always prefer an MDMS first, even if it is a peripheral area, because you need cutting. In DNB you will not be getting cutting, you will not be getting free hand exposure. Even if your institute will be having trust patients or some yojanas will be there, there will be opportunities for you to have a lot of patients, but consultants will not give you cutting easily because the burden is not that high as compared to an MDMS institute. Okay, so if you are getting an MDMS, prefer MDMS even if it is a peripheral area, because surgery needs cutting, hands-on patient load, usually better in MDMS setups. If MD is not available, then you go for DNB, but again prefer the high volume institutes, the government institutes, the district hospitals, in which you can get more patient load and which you can do cutting easily. Okay, so this is the biggest query in patient, a lot of students' mind, whether to go towards the medicine side or towards the surgical side. So institute selection order, again metro city institutes, they will have the best exposure, academic and networking. Then choose the institutes which are near to your hometown, because it will reduce your expenses, it will be a family comfort, and you can make more friends easily in that area, because after 3 years ultimately you have to go to your own area only. Okay, and then prefer the institute with lesser bonds. So see all these things in mind and then choose carefully. Explore before you decide. Now all our enrolled students will be getting a preference wise list of all the institutes. Okay, so once you get your tentative list, visit some nearby 2 to 3 institutes, because you will be talking to the seniors, you will check the workload there, you will see the exposure, you will see the lifestyle, and then you can see yourself whether you will be able to adjust there or not. Avoid noise and focus your path. Don't waste your time in scrolling the Telegram, WhatsApp group with random opinion. It will only create anxiety. Everyone's journey is different, so don't compare blindly. Stay focused and think logically, and you will make the right decision. Choosing your postgraduate branch, again, now very important thing, no branch is superior or inferior. This is my golden point for all of you. All the branches have equal potential. If a radiology has a pros, it will have a cons also. Okay, if a pathology have a pros, it has a cons also. Okay, even a radiologist is not completely happy, and a pharmacologist is completely happy with his life. Okay, so no branch is extremely saturated and no branch is extremely happier branch. Okay, every branch will have some ups and downs, so don't compare branches, don't compare your ranks with other students. Okay, because whatever branch you will have, some or the other potential that branch will going to give you up. Okay, pathology can give you options of doing hemat-oncology and DM and further many more things. Radiation oncology will give you options of doing DM, medical oncology likewise. So if you are doing radiology now, after radiology also the life is not complete, you have to go for fellowships. Interventional radiology is increasing nowadays, so no branch is good, no branch is bad, all will be a mixture of pros and cons. So you can make name, fame and money in any branch. Every branch has depth. It is your interest that you should guide the choice. Some branches allow early settlement like radiology, dermatology, anesthesia, organic, but again nowadays in metro cities especially, people are doing a lot of interventions and a lot of fellowships and cosmetology and all these things in these branches, pain management and everything. So these branches are also nowadays becoming some struggling branches. Some require late settlement, medicine, surgical branches, but over time the income and recognition that balances out. It is not that radiologist will earn 10 lakhs and a pathologist will earn 1 lakh. It is not that. Okay, everyone will become balanced at one point of life. So take a general overview before deciding your branch. So a quick branch overview I will give, and then I think Dr. Anshu has already joined us. Dr. Anshu?
Yes. Am I audible?
Yeah, Dr. Anshu is with us. So I'll just give a quick review of the branch, and then Dr. Anshu will give you some pros and cons over general medicine. Okay. So radiology, it has high income, less emergency, diagnostic role. Nowadays, these are the pros, but again, I'm saying nowadays intervention is increasing more and more. So people are going towards interventional radiology and fellowships. Dermatology is an OPD based branch. Cosmetic practice, huge earning, but again, cosmetology is nowadays increasing more and more. So dermatology is an OPD based branch, cosmetic practice huge earning, but again cosmetology is nowadays increasing day by day. General medicine, it is an evergreen branch, most clinical satisfaction, but again super specialization has now become mandatory, especially in the metro cities and in 2-tier cities also. So in 1-tier city you can still sit as a general physician, but 2-tier and 3-tier cities the DM are now increasing day by day. Again DNB has also started super specialization, so DNB medicine is DNB super specialized medicine is also increasing nowadays. So again a tough competition. Pediatrics, always in demand, strong private practice scope, super specialization is optional, but again the cons is a bit hectic branch. 9 to 5 job is a bit difficult to get in the next 4 to 5 years, because parent will not come to a young pediatrician immediately. You have to develop faith and confidence in a parent, because the child is so delicate that they will only come to a pediatrician who's already known and renowned. Okay. Respiratory medicine, it's the fastest growing and emerging branch, a terminal branch, but once again a cons that it has been removed from the syllabus of MBBS. So the new medical colleges which are now opening, they are not opening these separate respiratory medicine branches. Again, the general physician, you will have to give a tough competition to general physician to attract the patients of respiratory medicine, especially COPD, asthma, because the physician will also treat them. Okay. Intervention has now become mandatory in respiratory medicine. You need to learn all the procedures like bronchoscopy, thoracoscopy, bus, everything. Without that you cannot suffice with this branch. So you can see every branch has some pros, every branch has cons. Gynec, high workload, excellent for private setups, but again the life is very hectic. You have to be ready for emergency duties even in your night time, even after you become AP, associate, HOD consultant. The more you grow in Gynec, the more is your responsibility. The more senior you become, the more you learn, and the more people expect that you can deliver complicated cases. Ophthalmology, balanced lifestyle, independent practice possible, long learning curve, but again fellowship has become mandatory. Retina, cornea, a lot of things has come in ophthalmology, and the people are doing more and more fellowships. Okay, so settlement becomes a bit prolonged in that. Psychiatry, growing demand, less stress, OPD based branch, but again you have to compete with the general physicians to fed the patients, and IPD is less as compared to OPD. Orthopedics has a good scope but needs OT infrastructure. Very high competition nowadays, because a lot of orthopedicians are coming out. DNB seats have been opened and learning process is long. Again fellowships are increasing in orthopedics also. General surgery, broad foundation, again super specialization is mandatory if you're planning to settle in a 3-tier city or a 2-tier city. Okay. Emergency medicine, adrenaline rush, good scope in metro cities, and nowadays 2-tier cities and other medical colleges are also opening emergency medicine as a separate branch. But the thing is, you have to present in the emergency throughout your life for your duties. You will be having shift duties like 8 to 2, 2 to 8, 8 to 8, like this. Shift hour duties will be there throughout your life, and the duties will be always in the emergency. So you have to be mentally very prepared to deal the patient in any sort of emergency situation. You should have a thorough knowledge how to deal with the critical cases, how to deal with the CPR, how to deal with all emergency cases. So your mind should be extremely active to cope up with the situation. Whatever the patient is coming, you should have a kick in your mind how to deal the patient. But again, the duration is limited for working hours. You will have a 6-hour duty, you will have a 8-hour duty. After that you don't have to pick the calls. You only your work is in your duty hours. After that your life is free. Family medicine, it is just like a general practitioner. You should have a knowledge of everything like medicine, surgery, pediatrics, obstetrics, everything. Again, this branch is not very good for Indian setup as of now, because a family medicine counsels the patient that you are having a particular form of disease, and you need to show to this person, whether you want to show to a surgeon or a pediatrician or a medicine, and what are they going to do with you. So this is a more of counseling based branch. You can work as a general practitioner in your hometown. You can open your OPDs, but you cannot have your separate IPDs in hospitals. Plus there are not much of the job opportunities as a seat in hospitals for family medicine. Some of the corporate hospitals in big cities in Delhi and Mumbai, they have this family medicine as a separate option, but 1 or 2 family medicine is sufficient for a big corporate hospital also. So there is more of saturation. If you're planning to settle abroad, then this is a very good brand, because in abroad people need counselors. A lot of counseling is required to explain the disease, to explain the prognosis and everything. But for India, this is not that much good. PMR, it is gradually growing. It is a sports medicine and pain clinic associated with ortho and neurosurgeons. Okay, so you will be in touch with orthopedicians and neurosurgeons. You should know something about sport medicine, pain and everything. So this is again gradually going, not much scope in India till today. Pathology, again an evergreen branch. High interest is required, because you will have to look at the microscope and you have to make the things. Okay, you will not have a patient exposure directly, but indirectly the entire hospital depends on a pathologist. Respiratory medicine depends on a pathologist, a surgeon depends on a pathologist, an ENT physician depends on a pathologist, because whatever biopsies we are sending, we need a pathologist. Whatever you will say, our treatment will go according to that only. Okay, so everything, the entire hospital depends on microbiologist, the entire hospital depends on a pathologist. So directly you will not have communication with your patients, but indirectly you are the boon to the hospital, you are the backbone of the hospital. Okay, because if you will give a bad report, we will say, अरे यार कितना गंदा pathologist है, इसने report ही ऐसी दी है, then we'll go for second opinion, we'll go for the third opinion, like that. So the pathologist is a highly demanding branch. Okay, you have options to do hemato-oncology later on after doing your post graduation if you want, and you can enter in the clinical area also, but you should have a knowledge of each and every subject. Again, pathology requires a deeper knowledge to read the biopsies, to read the samples, to make the diagnosis, because the diagnosis will make the treatment. Anesthesia, whether you go for MD, DNB, diploma anesthesia, there is 100% job security, because all the ICUs run on anesthesiologists, all the surgeons are dependent on anesthesiologists. So you have many options. You can have options. You can do freelancing with your surgeons, the gynecologists, the orthopedicians, plus the ICU setups. The intensivist manages the ICUs, the pulmonary medicine people manage the ICU, the anesthesiologist, but usually the head of the ICUs are usually the anesthesia people only. So this is essential in each and every hospital, whether you are working in 1 tier, 2 tier, 3 tier city. You can do DM, DRNB fellowships in critical care later on in anesthesia. So borderline rank, what you are getting, if you are not getting MD, MS or a good DNB institute, don't panic. You still have multiple options. Repeat if you have energy and determination. I already said, only and only if you are confident enough that you can study again for 1 more year, then only repeat and aim for a better rank. Otherwise, whatever is available for your rank, take at that point, and later on you will be having ample of options. DNB, if you are having an average institute, take DNB from an average institute, complete your degree, and later on you can do SRship from a good medical college to strengthen your profile. Once you do SRship, your resume will be as equivalent to an MD student. There will be no difference. Diploma and secondary DNB, if you are opting for diploma, later on you will have to upgrade for secondary DNB. Pathway is equivalent to NDMS. Private seat, if financially possible, you can take a private seat in your desired branch. If you are exhausted and don't want to repeat, then take a seat this year. But remember, your branch will stay with you for a lifetime. Whatever institutes institute will decide your exposure and learning. So choose wisely. Both the branch and institute are crucial for your future. So our enrollments are already open. A lot of students have already enrolled. They have been allotted a guide, and they have been provided with the preference wise list. The guides are talking to them constantly. They are sharing the doubts, and we are there to guide you at every step till you get a seat. And after that, once you enter in your residency, we are having coaching platforms for you. There will be online coaching classes for medicine, pulmonary medicine, surgery, pediatrics. You can later on join with our coaching classroom also. Your seniors are already studying with us and they have been passed with very good results, especially in DNB medicine, DNB respiratory medicine. 100% passing rate is there. Students have cleared the exams with very good results teaching with us. Okay, but that is the next step. As of now, I'll share a slide and I'll request Dr. Anshu to put some light on general medicine.
Yes, sure. Kindly share my presentation, Dr. Shazia. Or should I share?
I've shared. Yes.
Okay. So, hi, good evening, students. I'm Dr. Anshu Arora. I have been into the field of general medicine for over a decade now. So, I'm here to share some insights with you regarding the pros and cons if you're deciding to choose your branch as general medicine. First of all, congratulations. You have made it so far. You have got a rank. So, it's a big thing. Many people can't even reach here. So, congratulations for that. Kindly move forward, Dr. Shazia. Now, the problem is that the question, the point in question is whether we should opt for internal medicine or not, right? It's a big decision, right? So, you should be properly aware of what are the pros and cons. So, as has been said by some great internists, internal medicine is not just about treating diseases, it is about treating people with diseases. So it carries a deep meaning. You should have the ability to connect deeply to the patients as a clinician, right? So I've inserted the picture of a Taj Mahal just to show you that it has two sides. It looks beautiful in day as well as night, but it is not the same as for medicine branch. There are pros and there are cons as is applicable for all branches. So let's go into the pros and cons, right? So we'll first discuss the negative aspects of it, and then we'll come over to the positive aspects. So the major, please move forward. The major negative aspect is that it's an emergency branch. Please gear up yourself for a hectic residency, right? 24/7 kind of a branch, and 3 years you're going to get no time. It is a hectic branch. You have to be available. You have to be on your foot all the time, right? But it is rewarding at the end of the day also. I'll tell you that in cons. Second thing is limited interventions. If you are a kind of person that interventions give you a thrill, so we get a very limited scope of interventions when we are talking of medicine. There are only a few procedures that we get to do. So you have to ask your soul what suits your soul better. You like interventional work more or whether you like conservative work more. And the most important is that it's a non-terminal branch. So these days, there is equal competition, rather a more fierce competition when we are talking of super specialization, entrance, DM entrance exams. So you all know it is going to be a long journey if you decide not to stop at MD and pursue your personal life also gets kicked off. Many students get into the frames of marriages and all. So it gets little tougher at that point. So decide at this point only whether you want to be satisfied after MD or whether you want to move forward. These are the three major disadvantages. But don't worry that I'll take you through them also. So remember, it's an evergreen clinical branch. You are the physician. Once physician, you are physician for forever life. Physician is required even at a primary health center, even at a community health center, at the most popular tertiary hospital of a city also, physicians will be required. So remember, PHC and CHC might not be having a dermatologist or anesthetist or maybe a radiologist, but they will be having a physician, right? So it's an evergreen branch. It can never go out of fashion. It is a branch with very low investment for practice. If you want to start your own practice, you don't have to put in a lot of money. You just need a chamber. You just need a very low investment setup, and you're good to go. You don't need crores and crores of rupees for buying instruments and all of that. Nothing of that sort. It's a very low investment startup for practice. Third thing is, it is a no dependency branch. So surgical surgeons and anesthetists are dependent on each other. They cannot function without each other. It's a well-known fact. So if you decide to get into your private practice also, you don't need to be dependent on anyone. You can independently practice your branch. That is a major advantage. Another major advantage is that AI, that is the so another thing is we can choose work-life balance. You can decide the number of hours that you want to put into your practice, and you can choose the number of hours that you don't want to put into your practice. You can choose to you can choose to pick up emergencies, and you can choose to refuse emergencies also. So work-life balance is little better maintained. You can choose your work-life balance if you wish to. And most importantly, the future of medicine has been taken over by AI to a great extent already. But this is one branch that cannot be replaced by AI to a great extent. AI cannot replace the clinical examination that a physician performs. Radiology, dermatology, most of the branches will be affected in the near future by AI, that is artificial intelligence. But this branch cannot be taken over. Clinicians will be valued forever throughout their life. And don't worry about money. As Dr. Shazia rightly said, once you are a good physician, once you are a good doctor, money will follow you everywhere in every branch. So don't worry much about money. Yes, these are time-taking branches. It takes little time for you to build your name. But once your name is built, it will be a highly rewarding branch, right? And always keep this in mind, that listen to your patient. He is telling you the diagnosis. If you're that kind of a person who likes talking to your patient, who likes discussing their troubles, who likes discussing their problems, and then getting to the conclusion and solving them. If you are that kind of a person who wants to keep your mind engaged rather than standing for long hours in the OT, then you are the one who wants to be getting into internal medicine. It is an evergreen branch. You will not regret getting into it. Only remember that it is not a terminal branch. So you don't have to get frustrated at the end of 3 years, because if you are sitting for the another set of entrance exam and going through the drill again, yes, you have to do it if you want to do it. So decide just at this point if you want to go for that far, or you want to finish your career after MD only. You finish your studies rather at the completion of your MD only or DNB. So that is one point you have to very precisely decide even at this point. That is one of the major disadvantage. But anyhow, even if you decide to be in medicine branch, most welcome, and you will not regret your decision. It's a wonderful branch. You get a lot of patients. Every department needs to get in touch with medicine department at some point of the time, right? So we do have a lot of patients. We don't need to go out to find patients. Patients come and find us, right? That is one very big thing. So we at Mentora have been mentoring lots of students who get into internal medicine to help them clear their final exams. So we have been doing that for past 1 year, and recently we also concluded the practical crash course. So that's another step for you. So if you decide to get into medicine, so all the very best to all the students. We are there to help you at any time, at any stage of counseling, and even after that if you decide to join general medicine. So all the best to all students.
Thank you, Dr. Anshu, for giving us time. So this was a very good explanation regarding general medicine. Now I think things will be very clear to you whether you are ready to go for medicine or not. Okay. So this was the end of our session today. If you still have any doubts, you can ask. You can ask in the chat box also. We'll open the chat box for next 5 minutes. If you have any doubts, you can ask us. So these are our offers. If you are enrolling for all India, for state we have opened only 2 states as of now, Maharashtra and Gujarat. So if you want to get a counseling for Maharashtra state or Gujarat state, you can enroll with us. All India we are open for everything, MD, DNB, government, deemed, everything. Okay. MD respiratory versus DNB, again these are 2 separate branches. If you are interested in going for respiratory medicine, you can definitely go for it. Don't compare MD versus DNB at this point. Compare the likes. If you like medicine, go for DNB medicine. If you like respiratory, then go for MD respiratory, because at this point of time you don't know what is there in respiratory medicine. Okay, so first you see what is there in respiratory medicine, because it will be a limited area branch. You will have to be taking care of only respiratory cases. You will not be able to see the entire general medicine as a whole. Okay, so don't compare MD and DNB, compare the branch. If you want to go towards medicine, and if you're willing to go to do DM later on, go for medicine. If you're not willing to go for DM, if you're well settled with an end branch, then you can go for respiratory medicine. DNB general medicine from average or MD respiratory. Again, I'm saying don't compare DNB versus MD at this point. Okay, you choose the branch first. Choose medicine more or respi more. If medicine more, go for DNB. There is no issue in going for DNB. If medicine less and respi more, then go for respi only. Okay, so there is no such comparison. Ortho versus obs gynec as a male candidate for private practice in 2-3 tier city. See, there are many states who are still not acceptable in taking male obs gynecologist. Okay, especially Rajasthan, Bihar, Uttar Pradesh. Here people do not prefer to take females to a male obs gynecologist. Okay, whereas in some states like Maharashtra, Gujarat, the male obs gynecologists are working very well. Okay, there the patients prefer to take the females to a male also. Okay, so it depends in which city you are planning to settle. If you are planning to settle in Rajasthan, Uttar Pradesh, Haryana, Bihar, Punjab, in these areas, then better to go for orthopedics rather than obs gynac, because the people's mindset is not ready to take their females to a male obs gynecologist, and this tradition is there. It depends on the state to state. Gujarat and Maharashtra, Bangalore, they accept. So for enrollment, the Mentora NEET PG Counselling, the numbers are given. The next Zoom session will be on counseling rules and regulations according to the latest information guidelines, fees, stipend and bond details. So whenever your rule book will come, as soon as your seat matrix will come, we are going to come up with another Zoom session. There was admission in MD anesthesia and AIQ at 30 medical the cutoff. So these questions will be explaining later on. One more thing, if you are taking DNB and if you leave the seat after joining the DNB seat, you will be debarred for the counseling for next 3 years. Okay, so this point you keep in mind and be very sure of taking DNB, because after taking a DNB seat, you cannot leave the seat. If you will leave the seat, for the next 3 years, you will not be eligible to sit in the DNB counseling. So be very sure, be very confident before joining your DNB institute. All the very best. One more question. Sitting for SS after 3 years, then should I choose SP based on this or should I stick to it? If you are not ready to go for SS and if you are planning to settle in a 2 or 3 tier city, better to go for respiratory medicine, because 2 and 3 tier cities will be demanding SS nowadays. Without that, you cannot practice until and unless you are getting a government job as assistant professor in any medical college. You don't have other options, and these medical colleges are also having limited seats, especially in general category. There will be category seats, so the options will be limited for you. So if you are sitting in 1 tier city, it is good that you can take medicine, but if you are not, then you can go for respiratory medicine. But again, nowadays SS has been increasing in respiratory medicine also. People are doing DM in respiratory medicine also, so that is also going to give you a tough competition. So I think we should end up with today's session. So good luck all of you, and our enrollments are open. If anyone still wishes to enroll, you can contact us and we are here to help you till you get a seat. So all the best to all of you and good night all of you.